Good afternoon. My name is India Curry, and today I'm going to be presenting a quality improvement project that I implemented entitled Do College Freshmen Know Their Numbers? Cardiovascular disease, also known as CVD, is the leading cause of death in the United States and across the globe. Cardiovascular disease is the leading cause of death in the United States in both men and women. Each year, nearly 630,000 individuals die of some form of heart disease, and over 4.2 million individuals are hospitalized. In saying so, the associated cost is approximately $475.3 billion annually. The age of onset of CVD can be very early in life, and over time, the disease is influenced by many factors. Some factors are modifiable, such as smoking cessation and engaging in physical activity. Some factors are unmodifiable, such as a family history of hypertension, diabetes. The increasing risk of CVD among adults is understudied and overlooked. However, CVD is preventable. The purpose of this quality improvement project was twofold. First, it was to demonstrate that the target population of 18 to 20-year-olds is at risk for CVD. Second, it was to assess the effectiveness of a theoretically driven educational intervention that includes knowing critical health values to improve the health practices of young adults as it relates to cardiovascular disease. The rationale for this project is that young adults are at risk for early onset of CVD, which is preventable with early intervention. Although the issue of CVD has been around for many years, awareness of the disease remains a major issue. A study by Go ETAL 2014 found that from 2009 to 2010, 81.9% of adults were aware that they had hypertension. However, awareness in young adults between the ages of 18 and 39 was lower than that of adults 40 or older. Collins and colleagues, 2004, found from a study of college students that 85% had never had a discussion with their doctor about heart disease and the related risk factors. It has been well documented in the CVD literature that young adults in college in Western countries such as the United States tend to have a higher prevalence of lifestyle-related cardiovascular risk factors. And these same young adults are at risk for early CVD. This fact supports the need to investigate the level of awareness of the critical health indicators among college students. The project study design consisted of a pre and post test study design. The target population was young adults, which are persons aged 18 to 39. However, the sample was first time second semester and non-commuter college freshman students. It was a convenient sample, and the project occurred at a historically black college and university located in New Orleans, Louisiana. Data collection instruments were 5 to 7 minute pre and post intervention surveys. The post intervention was administered 1 to 2 weeks post op of the intervention. The total duration for data collection and delivery of intervention was 1 to 4 weeks. Data collection was confidential and anonymous. To ensure this, the pre- and post-intervention survey data was linked by a participant-generated personal ID, which the participant generated on his or her own. There were 6 domains of measures collected between the pre- and post-intervention surveys. Demographics, which was collected only at baseline. Knowledge of participants' health-related numbers, such as glucose and cholesterol. Health behaviors, such as physical activity and diet. Knowledge of the normal values of health-related numbers of healthy adults, which was collected at baseline via the pre-intervention survey, and follow-up via the post-intervention survey. Intention and or action to know their health-related numbers, modify their current lifestyle to incorporate healthy eating and physical activity was ascertained in the post-intervention survey. The Know Your Numbers, or KYN intervention, is comprised of a 50-minute PowerPoint presentation and a 2-page brochure on knowing the critical health numbers for cardiovascular health. Both the slide presentation and Know Your Numbers brochure were developed by the Mississippi Department of Health Chronic Illness Coalition. The PowerPoint presentation communicates the risk factors to cardiovascular disease and addresses how certain lifestyle modifications can improve one's health practices and reduce one's risk for cardiovascular disease. The following statistical analytic methods were used to analyze the data to examine the level of awareness of participants knowing their numbers and assess the effectiveness of the intervention. Descriptive statistics was used to describe characteristics of the study sample. Paired t-tests were used to assess changes from pre to post intervention of key outcome measures. McNeman chi-square tests were used to test for changes in the knowledge of health-related numbers. And multiple logistic regression models were used to determine correlates to A, intention to modify behavioral lifestyles, and B, action taken to know their critical health numbers and or adopted healthy lifestyles post-intervention. Table 1 provides description of the characteristics of project participants in terms of demographics, knowledge of participants' health-related numbers, health behaviors, and knowledge of the normal values of health-related numbers of healthy adults. The information is gender-specific and for a total sample. Highlights from Table 1 are: female students were the majority of the project participants, 87.9%, which is reflective of the female to male ratio of the institution. The sample comprised primarily African American and Asian students. At baseline, students' knowledge of their cholesterol was very low, approximately 6%. The percentage of students who had knowledge of their blood pressure levels ranged from 24 to 30%. And approximately 7 to 12% of the students had knowledge of their blood glucose. Of the 4 measures, body mass index, or BMI, was the only measure that the percentage of participants were aware of their numbers was greater than 35%. The range was 35.3 to 43.9%. Also, approximately 17 to 25% of students indicated that all four of their health indicators were in normal range. There were obvious gender differences in assessing the four health indicators. Looking at Table 2, this table provides a summary of the comparative analysis of key outcome measures pre and post intervention. For the health-related numbers, there was a significant increase from pre to post intervention in knowledge of total cholesterol and blood glucose. Knowledge of total cholesterol had a p-value that was equal to 0.0023, and blood glucose had a p-value that was equal to 0.0075. Likewise, on the correct response to reference range of the various health indicators, there was a significant increase from pre to post intervention in indicating the correct normal range for total cholesterol, with a p-value that was equal to 0.0018. For the derived composite scores, there was a significant increase in the mean score of participants' knowledge of their numbers, with a p-value that was equal to 0.0238. Continuing with results. Figure 2 provides a graphical display of the distributions of the impact of the intervention on intention to change and actual change. Intentions to adopt a healthy lifestyle and choices were encouraging. They range from 47.4% among those intending to know their numbers to 61.8% among those intending to improve their diet. In assessing those who had taken action after the acquisition of knowledge about their critical health numbers, the area where the participants experienced the lowest level of change was knowing their numbers, which was at 23.2%, and the area where change occurred the most was an increase in water intake, which was at 44.2%. Table 3 provides summaries of the correlates of positive intentions and actions and healthy lifestyle choices. The significant correlates of positive intentions and actions and healthy lifestyle choices were as follows. For increase in physical activity, the significant correlate to intention was pre-test knowledge of normal values, and pre-test knowledge of numbers was a significant correlate in action. For pre-test knowledge of normal range values, the odds ratio was 2.61, with the 95% confidence interval 1.25, 5.45. And for pre-test knowledge of numbers, the odds ratio was equal to 1.95, with the 95% confidence interval 1.04, 3.66. This slide summarizes the key findings from the KYN Quality Improvement Project. The key findings are: body mass index was the only one of the four indicators with the percentage of the students knowing their number greater than 35%. Another finding was that approximately 16 to 25% of the students indicated that all four of their health indicators were in normal range. There were obvious gender differences in assessing the four health indicators. Knowledge of participants knowing their numbers was statistically significant, with a p-value that was equal to 0.238. Also, intentions to adopt healthy lifestyle and choices range from 48.9% of those intending to know their numbers to 60.2% intending to improve their diet. Lastly, the area of most improvement in taking action was increase in water intake at 43%. There are three main points that can be made based on the outcome of this quality improvement project pertaining to the significance to nursing practice, and they are: 1. The KYN project will make a significant difference in patient outcomes through primary prevention. It is an inexpensive project that can be applied to any setting in any population by non-advanced practice nurses. 2. Patient education is a core component of nursing, and it is measured as part of quality patient care. Therefore, nurses have the ability to target individuals in any setting. With the new healthcare reform, the high cost of medical care is of big concern. Lastly, because patients are expected to take ownership of their health, nurses can assist in this transition by providing information and education to their patients. When patients take ownership of their health, in conjunction with their primary healthcare providers and other healthcare specialists, collaboration is noted and positive outcomes are witnessed. The outcomes and key findings from this project, coupled with lessons learned, have led to the following conclusions. The project confirms the suspicion that on average, young adults of college age do not know their critical cardiovascular health numbers. There is a need to educate the target population on the importance of knowing their numbers and the normal ranges for their total cholesterol, blood glucose, blood pressure levels, and body mass index. Although the educational intervention showed a minimum effectiveness, it shows great promise. Hence, further research is needed. A mixed approach should be considered in replicating this project. Also, the KYN Quality Improvement Project needs to be implemented in both academic and community settings where the target population can be reached. I would like to acknowledge my faculty advisor, Dr. Hamilton, and project mentor, Dr. Sarpong, for the guidance and assistance. They will also serve as co-authors of the manuscript derived from this important work. Special thanks to the students for participating in this important project. Also, residency hall directors and director of housing at the project site who were instrumental in the conduct of the project. Institutional support, the contribution of Dr. Daniel F. Sarpong on this project was partially supported by the grant 5S21MD000100-12 from the National Institute on Minority Health and Health Disparities, National Institutes of Health, and the Department of Health and Human Services. The following are references cited in the introduction and background sections of this presentation. Thank you for your time and attention. Now, are there any questions?